Hello, I'm Joan Justice, and I'm here today with Kevin Palattao, Vice President of Health Partners Clinics and Virtuwell, an innovative online diagnosis and treatment service. Kevin has 20 years of experience with healthcare operations and information technology, and he's the one that led the implementation of the health record system at Health Partners. Kevin, tell us how Virtuwell got started and the successes that you've had so far.
Sure. Well, a number of years ago, we were having a discussion here at Health Partners, and we concluded that if we keep practicing medicine as we do today, healthcare is going to become a colossal burden for humanity. And we'd also been spending a lot of time studying, how has technology changed the way that we interact with each other as human beings? And it became clear to us at that point that the internet and mobile technology had fundamentally changed communication patterns among humans. And we were really interested in understanding how could we apply those everyday tools that people had become accustomed to in their lives in the healthcare context. We were also really, I think, smitten by the concept of the triple aim, meaning how can you simultaneously improve quality, create exceptional experiences, and do it all at affordable cost.
Sure.
And so those things were really driving, our pursuit of developing something new. And so out of that came the idea of Virtuwell. And in Minneapolis, this is a very competitive retail clinic market. And so we've had Minute Clinic and Target Clinic operating here for quite some time. And frankly, I like to credit them for really uncorking the way that we think about convenience care in the United States. And they brought a consumer lens to an otherwise healthcare experience. And so as we were thinking this through, we thought that using technology, we could do even better things than we could do in walk-in clinics. And so those things combined led us to develop Virtuwell, and we launched in October of 2010. Since then, we've had about 55,000 customers come through and use the service. We've had an equal number of people come through and use the service and hit one of our safety protocols that suggested in-person care was a better option given their situation. And so we treat about 40 common conditions, and we really try to limit the things that we do that we can do safely online. And for those things that require a lab test or an imaging study or a physical exam, we try to redirect those people to the appropriate doctor's office or even retail clinic. And so, all said and done, over 100,000 people have experienced Virtuwell so far.
I think that's absolutely wonderful. And what about the limitations involved? What about the licenses? I know that doctors aren't supposed to treat patients in another state, for instance. Tell us a little bit about that. What's going on there?
Yeah, it's a really unique situation in our country. Medical licensing is done at the state level, and every state has its board structure. And there's the medical board, which typically governs nurse practitioners, physician assistants, and physicians. There's also the nursing board, that's part of the nurse practitioner structure. And then there's the pharmacy board. And all of them weigh in on topics like internet prescribing and online care. And so every state has to make its choices about what it considers to be safe and effective approaches to online care. We're very fortunate in Minnesota that this is one of those states that is progressive and has statutes that allow innovations like this to emerge. Our fellow states in Wisconsin and Michigan are also progressive that way. And so we are operating now in those three states. And so anyone living in, working in, or traveling to those states can use Virtuwell. As we look across the country, however, not everyone sees the world that way. There are many areas that still consider in-person, face-to-face visits the only way that care can be delivered. And so they prevent us from prescribing over the internet or even rendering a diagnosis and treatment plan. So we're looking at all of the states out there right now to try to understand which ones are open and receptive to our clinical model and which ones are not. And we'll be interested in expanding where those statutes allow.
So you are going to expand maybe into Virginia, where I am?
We'd love to be in Virginia to help you out.
Yeah, I would love you to be here too. I think it's a wonderful idea. So you create an electronic record for each patient, is that correct?
Yeah, that's right. We take all of our patients through an interactive interview process, and as a result of that, we are simultaneously creating their electronic health record. That becomes available to them 24/7, 365. We never close at Virtuwell. We're always open. So if they ever need access to that information, in a future appointment, we've got that information available. If they want to share it with somebody in their family, or if there's another care team member that they trust, they're free to share that information with those people as well.
That's great. Now you can go on the site and kind of test drive Virtuwell, right? You don't have to really commit or pay, and also visible pricing. It's $40. We didn't mention that, but visible pricing, and it can be reimbursed by your insurance. Or if you don't have insurance, you pay the $40, which certainly is reasonable. And you can go through, I want to tell our readers, you can go to the site and test drive it and see what it's like, and you don't have to commit to anything until the end. Is that right, Kevin?
Right. Yeah, that's right. Transparency was one of the design attributes that we had in creating Virtuwell. And so we wanted to be very clear up front about what this would cost. So you're right, it is $40. That's the most it'll cost. Many people file insurance with that. So it's going to be your copay or whatever your deductible is. So it's oftentimes less than that, but nobody will pay more than $40 ever. We do file claims on your behalf, so we'll submit a claim to your insurance company. We wait for that remittance advice to come back, and once we understand if you have a responsibility, we'll just debit your credit card and send you an electronic receipt for that. We did create an open architecture on this, so yeah, hit the Start Diagnosis button and take it for a test drive. You'll have an opportunity to see the quality and the safety that's engineered into the system. You might even hit one of our safety protocols that suggests in-person care is a better choice. And one of the neat things about our site is that we don't give you general advice. It's very specific. After all, you've just taken the time to give us some very specific information about your unique situation. So we'll explain to you if we have to stop the interview, why we stop the interview, what we worry about, and what the standard of care is that you should expect for the things that you're presenting with. Now, a lot of people have doctors, but in our experience, more than half say, I don't associate with any particular primary care doctor. So we have a nifty provider finder application that allows you to find a provider in your community that can help you out with the things that you're presenting with. Just type in your zip code and we'll give you a list of doctors that are appropriate.
I love it. Thank you so much, Kevin. I love the Health Partners website and the idea of Virtuwell, and I'd certainly use it if it were here in Virginia. Thank you so much.
You're welcome. Thanks for having us.